Okay, so I'm going to be doing my presentation over myofascial release. So starting off, the learner objectives. So by the end of this presentation, learners should have a better understanding of how to perform myofascial release, how to perform self-myofascial release, and the benefits of myofascial release for the patient. So also I want to point out that from here on through the rest of the presentation, I'm probably going to utilize MFR, which is the same thing as myofascial release, but I'm just shortening it down so I don't have to keep saying the whole word. So what is MFR? It's a hands-on technique used to manage myofascial pain. So myo meaning muscle and fascial meaning connective tissue that covers and supports the muscles throughout your entire body. So usually your healthcare provider will locate trigger points, knots, fascial tissues, and gently apply pressure until they feel the tension release. So I added in this picture here because it gives a good demonstration of, for one, a common spot that patients usually have trigger points, so in that upper neck. And the therapist is probably getting to the point where she's pushing that knot up and then she's going to start applying some of that pressure. So I just thought it was a good demonstration of, for one, a location of a trigger point and then how it's a direct contact technique and the therapist is using their hands and that they're eventually going to be applying pressure to that knot. So let's get into indications, contraindications, and precautions for MFR. So some of the indications are physical trauma. So this can be anywhere from falls, car accidents, or whiplash. Second one, scarring. So from frozen shoulder, burns, surgery. Third one, inflammation. So anything like bursitis, OA, or plantar fasciitis. And then the fourth one, compressed nerves. So this can be anything from herniated discs or carpal tunnel syndrome. And the last one being repetitive stress injuries. So heavy lifting or poor posture. So definitely that one, I feel all of these definitely are indications of MFR, but the repetitive stress injuries, like the heavy lifting or poor posture, 9 times out of 10, I feel like the poor posture has caused a lot of trigger points in a lot of people's bodies versus maybe some of the other things. These are all very important still, but everybody I know pretty much has bad posture, and those muscles get tight from you constantly having bad posture, and it causes these trigger points. And a lot of people think it's something that they did to themselves, but really it's just these trigger points building up in their body from having terrible posture. So I just wanted to point that out. So some of the contraindications are malignancy, aneurysm, acute RA, advanced diabetes, severe OA, and healing fractures. So one of the ones that I definitely wanted to point out, because in the next slide, we're going to talk about fractures again. Healing fractures, definitely just not a good idea, and you should not do, obviously, because for one, you're disrupting the healing process. For two, you don't want to take the risk of re-injuring the, bone and fracturing it again. So, but here's where it gets not tricky, but I'm going to go into kind of why you might be able to do it. So precautions, bone fractures. So the reason why this is a precaution is because if a patient has a bone fracture somewhere completely different than the trigger point or the place where they're feeling tight, that's not really going to be a contraindication. That's something that you still can consider using. You just have to be cautious of it. When it would be a contraindication is if they're going to have if they have the trigger points near the fracture, then no, you cannot do that because it's going to possibly re-injure the patient or cause them more pain, obviously. So it's just a no-no. But if it's in a totally different place, it's something you can do. So don't think, oh, this patient just had a fracture, I can't, do it to their shoulder even though their fracture was in their leg. That's probably fine. It's just if they had the fracture in their leg, you probably shouldn't do MFR in their leg. So, and then burns and open wounds. So these ones are pretty self-explanatory as well. You're obviously not going to want to do a direct, hands-on activity on a patient who has burns or open wounds. That's just something that's very self-explanatory if you really think deep into it, because you're not going to want to possibly infect the wound, or with burns, you're not going to want to make the burn worse or damage the skin. I wouldn't say make the burn worse, but to damage the skin. For one, it's going to cause a patient immense pain. But this kind of goes into what I said about the bone fractures. If their burn or open wound is on their foot and you want to do MFR on their shoulder, that's not going to really affect anything. And then DVT, obviously, if we're going to be working anywhere where they have known DVT, it's just something you want to be cautious about. Just make sure you have it in the back of your head. Make sure you're, paying attention to signs and symptoms. And then conditions that require blood thinners and metabolic conditions. So basically the efficiency of myofascial release. What did I find? So I went through several of our articles that were listed in course content, but I also found an article myself on the internet that I felt talked really highly of MFR, and also to add in those articles that we have listed also talk pretty highly of MFR as well. I didn't find many negative things talking about why MFR is not, beneficial for patients, but I do think, according to this article and plus the other ones I read, I think there could still be some more extensive research on it. But according to several of the research articles, the efficiency of MFR has several positive results. So specifically, a research article I found researched the effects of MFR for adults with upper extremity and cervical spine, orthopedic, and peripheral nerve conditions, and if that leads to functional outcomes. So does it lead to decreased pain? Does it increase their range of motion compared to TheraX and other manual techniques or modalities? In total, there were 23 research articles in the evaluation that displayed moderate evidence to support MFR. So I also linked the article for you down here if you want to click and read it. I found it to be very helpful. They went over the entire study that they included, what some of the participants were required, what they required to have for them to even test, and a lot of the results were positive. So, and they go into why they were positive. They go over specific results that displayed the positive results. So how do we perform MFR and what's required? So usually the session will take place in a private room. Your provider will first locate the fascial tissue throughout your body that feels tight and stiff. So these are called our trigger points. And once the provider locates the knots, they'll apply gentle, constant pressure to those areas, and they'll do so without any oils or lotions. So one of the reasons why is because this is not the same thing as massage. We're not just trying to loosen up their tissue. To an extent we are, yes, but these are actual trigger points, and we need to we have to be able to release them and be able to press down on these trigger points. And if we're using oils and lotions, the likelihood of that being effective and being able to apply the pressure that we need to is just not likely. So the oils and the lotions are not recommended for MFR. And then lastly, the pressure will be applied slowly in order to lengthen your fascia, along with kneading repeatedly. So the provider will continue to do so until they feel the release of the knot under their hands or fingers. So this is another thing, if you have oil or lotion on your fingers and you have to hold down on this person's trigger point for like 20 to 30 seconds or longer, I don't find it likely that you will be able to do so without slipping if you have oil or lotion on your hands. And it's important as the therapist to feel that release of that knot, to know that the tension is starting to release. So how do you perform MFR in your own body? So one thing to note is when you're performing self MFR, you're likely going to be utilizing a tool. So if you were to do this in person with the therapist, your therapist is basically your tool. Their hands are your tool. So if you're wanting to do this at home, you're obviously not going to have your therapist. So you're going to be likely utilizing tools, and I'll go over some of those on the next slides. But first, you'll want to start out with softer tools and apply light pressure. So if you're just starting off with this, your trigger point's pretty sensitive, you're going to want to use the softer tools and apply light pressure. And then another important aspect of this is to focus on your breathing. If you're all tense and, basically, yes, if you're tense while you're doing this, I know it can be sometimes uncomfortable, but the more tense you get, the less likely I feel it is for your trigger point to release. So you want to try your best to do deep controlled breathing to enhance the effect of MFR. And then you're going to want to target tight areas. So hold the tool on a tender spot for 20 to 30 seconds to allow the muscle to relax and release. So it's also recommended to use short sessions and to aim for about 10 to 15 minutes per session. And then the most important is to obviously listen to your body. So avoid pushing through pain. Mild discomfort is normal, but sharp or intense pain can indicate you're utilizing too much pressure. So I talked about this before, maybe I haven't, but it's not supposed to feel terribly painful. You're obviously, creating some discomfort because a trigger point is painful. And so when you're pressing down on it with pressure, it's going to feel a little but it shouldn't be to the point where you're in intense pain and crying. So if you start to feel that way, it's a good indication that you're probably using too much. So I wanted to go over some of the common tools utilized for self MFR. So first we have the foam rollers, and there's different types. So I wanted to go over some of those. Starting off, we have the smooth roller, and these are ideal for beginners or those with sensitive trigger points. So they provide a more gentle massage for large muscle groups such as the quads, hamstrings, and the back. And then we have the textured roller, which we've seen in class before. We have one in our classroom, which comes with ridges or knobs, and it offers a deeper, more targeted massage, and it's more suitable for specific areas of tightness. And then we have a high density roller. Not really sure if I've seen one of these before, but they're more firm and provide intense pressure, which is ideal for athletes or individuals with chronic muscle tightness. So that's basically it for the foam rollers. And then I had massage balls. So starting off, we have lacrosse, which these are more firm and dense, which are perfect for deep tissue massage. So if you notice between this one talking about how it's firm and dense, and then one of the rollers being more firm and dense, those are good for deep tissue massage. It's also, the lacrosse ball is good for hard to reach areas such as the glutes, hips, and shoulders. And then we have the peanut massage balls, which is basically, self-explanatory. It looks like a peanut. So it looks like two of the lacrosse balls put together. And it's great for rolling along the spine and working on the muscles of the upper and lower back. And then we have the soft massage ball, which is for a more gentler massage and suitable for more sensitive areas for beginners new to the SMFR. And lastly, we have massage sticks. And the first type we have is traditional. And these have a cylindrical design with handles on both ends. They're excellent for rolling out the legs, calves, and arms, which allows you to control the pressure by adjusting how hard you press. I'm pretty sure I've used one of these before, and I found this pretty helpful for me because I get a lot of my trigger points in my upper traps, and it's really hard to try and release tension when it's on your upper trap, so I use the traditional massage stick. And then there's also a textured one, which comes with ridges or bumps that provide a deeper massage, and they're ideal for breaking up muscle knots and releasing tight fascia. So what are the benefits of myofascial release? So first and foremost, treating pain. And then we have decreasing the pain from fibromyalgia. And then increased blood flow, improving range of motion, speeding up muscle recovery, alleviating chronic lower back pain, improving sleep, reducing anxiety and depression, and overall improving the quality of life. So honestly, a lot of the benefits of MFR are things that we see patients have, trouble with every day. So it's definitely a technique that I think should be used more often. And manual therapy, I think, is huge. It's a really important thing to do because I think it's important to truly feel the tissue, see what it feels like and what's going on in the patient's body. And I'm a huge advocate for manual therapy because I think, like I said, you can feel what's going on in a patient's body. And I love this technique because you can actually feel that tension release. So I definitely think this is a great technique for all of these, as it says it's a benefit for. And then how do we do MFR training? So some of these MFR trainings can range from a weekend seminar to an extended program with hundreds of hours of coursework. And the programs usually cover techniques, evaluation, assessment, and treatment approaches for common complaints such as low back pain and neck pain. And one of the things I had in here was this picture. I thought it was neat. It's myofascial lines. So they have the superficial lines here, the functional lines, the lateral lines, and then the spiral lines. I just thought it was a neat picture to show where the myofascial tissues run through the body. And that is it.